Today we're going to delve into a very important topic for digestive health: gastritis. Have you ever heard of this condition? Simply put, gastritis is an inflammation that occurs in the inner layer of the stomach, known as the gastric mucosa. This inflammation occurs when there is a delicate imbalance in the functioning of the stomach. On one side, we have the protective mucus, a gel-like substance that coats the stomach wall, acting as a shield against the corrosive effects of hydrochloric acid. On the other, the hydrochloric acid itself, essential for digestion, but which can become a villain when left unchecked. This imbalance can be caused by several factors. Stress, for example, is one of the main culprits as it interferes with the proper functioning of the digestive system. In addition, prolonged use of certain medications, such as anti-inflammatories, can reduce the stomach's natural protection. Finally, the presence of the Helicobacter pylori bacteria, often found in raw or poorly cleaned foods, is a common and often silent cause of this inflammation. Understanding the origins and triggers of gastritis is essential to prevent and treat the condition, ensuring a more balanced and calm digestive health. Let's explore more details on how to identify, treat, and avoid this very common problem. Common symptoms of gastritis. How to identify the signs in your body. Gastritis can be a silent condition or manifest itself through symptoms that we often mistake for common discomforts. However, it is important to pay attention to the signs that the body gives, as identifying the symptoms early can make all the difference in diagnosis and treatment. Let's better understand how this inflammation in the stomach can present itself. Pain in the stomach region. One of the most common symptoms of gastritis is pain located in the upper region of the abdomen, close to the stomach. This pain can be described as stabbing, a burning sensation, or even a constant burning. It usually intensifies after meals or when the stomach is empty for a long time, since hydrochloric acid can further irritate the inflamed mucosa. Frequent burping. If you have been feeling that your burps are more frequent or accompanied by a bitter or acidic taste, this could be a sign of gastritis. This symptom is caused by the accumulation of gas in the stomach, often the result of compromised digestion, nausea, and in some cases, vomiting. Gastritis can also cause a persistent feeling of nausea, even when you have not eaten anything or are far from meals. In more severe cases, this nausea can progress to vomiting, which in some cases may contain traces of blood, indicating severe irritation of the stomach lining. Heavy stomach feeling. Another very common symptom is the feeling of a full or heavy stomach, even after consuming a small amount of food. This occurs because inflammation in the gastric mucosa impairs the stomach's ability to digest properly, leaving food in the digestive tract for longer. These symptoms can vary in intensity depending on the severity of the gastritis and its causes, such as stress, inadequate diet, or bacterial infection. If you notice these signs on a recurring basis, it is essential to seek medical advice for an accurate diagnosis and appropriate treatment. Remember, taking care of your digestive health is essential for your overall well-being. Foods to avoid. Protecting your stomach with conscious choices. When it comes to gastritis, diet plays a fundamental role, both in preventing and relieving symptoms. Some foods and drinks can be real villains, aggravating inflammation and further irritating the delicate stomach lining. Knowing what to avoid is essential to maintaining the balance of the digestive system and reducing the discomfort associated with this condition. Stimulant drinks, more problems than benefits. Some popular drinks can be extremely harmful for those suffering from gastritis. Among them are soft drinks rich in carbonation and sugar, which can cause bloating and increase stomach acidity. Coffee, although loved by many, contains caffeine, a stimulant that can irritate the gastric lining, especially if consumed in excess or on an empty stomach. Cola-based drinks should also be avoided for the same reason, as well as energy drinks or very strong teas, such as black or mate. Fatty foods, a danger to the stomach. Fried foods and foods high in fat are a dangerous combination for those who already have gastritis or want to avoid it. They are difficult to digest, which overloads the stomach and can aggravate inflammation. Among the most common examples are fried snacks, such as coccinelle, pastel, and kibbeh, as well as fast foods, such as hamburgers. Even foods prepared with excess oil, such as French fries or breaded foods, are on the list of restrictions. Why avoid these foods? The foods mentioned, as well as others that stimulate the production of gastric acid or directly irritate the mucosa, make the environment in the stomach even more aggressive. This can lead to the worsening of inflammation and intensify symptoms such as pain, heartburn, and nausea. Dietary recommendations: choices that promote health and well-being. When it comes to taking care of the stomach, especially in cases of gastritis, diet is a powerful ally. Choosing the right foods can not only alleviate symptoms, but also help in the recovery of the gastric mucosa and in the prevention of new episodes. Here are some detailed guidelines for a diet that protects and strengthens your digestive system. Include cooked vegetables. Simplicity that does good. Cooked vegetables are an excellent choice for those who need light and nutritious meals. Potatoes, for example, are a great option, whether mashed or simply cooked, as they are easy to digest and help to neutralize stomach acidity. Cooked carrots are also a good choice, as in addition to being soft, they offer important nutrients, such as vitamin A, which can help in the process of gastric tissue regeneration. Tip: to ensure maximum benefits, avoid heavy or very spicy seasonings. Prefer to season with natural herbs, such as parsley, chives, or a dash of olive oil. Cooked and peeled fruits, sweet allies for the stomach. Fruits are rich in nutrients, but for those dealing with gastritis, it is essential to consume them in a way that does not aggravate the condition. Cooked fruits such as apples or pears are light and offer soluble fiber, which aids digestion without causing irritation. Removing the skins is important as they can be more difficult to digest in cases of sensitive stomachs. Tip: an apple puree or a cooked pear with a touch of cinnamon can be a healthy and comforting dessert, perfect for those who need something light and nutritious. Opt for grilled and natural foods, lightness and flavor. Lean meats such as chicken and fish when grilled are excellent options for including protein in the diet without overloading the stomach. Combine with light sides, such as white rice or vegetable puree, for a balanced meal. Natural fresh foods without the addition of heavy sauces are always preferable, as they do not irritate the gastric mucosa or stimulate excessive acid production. Tip: to add flavor to meats, replace fatty sauces with natural seasonings, such as lemon, rosemary, and a pinch of salt. Why avoiding alcoholic beverages is essential for those suffering from gastritis. Alcoholic beverages are widely consumed on various social and cultural occasions, but for those who face problems such as gastritis, they can be a real enemy of stomach health. Alcohol is known to be one of the main causes of irritation of the stomach mucosa, contributing to both the onset and worsening of this inflammation. How does alcohol affect the stomach? When we consume alcohol, it comes into direct contact with the stomach wall. This substance has irritating properties that compromise the layer of mucus responsible for protecting the gastric mucosa. Without this protective barrier, gastric acid, which is essential for digestion, begins to directly attack the stomach tissue, causing inflammation and increasing sensitivity. In addition, alcohol can stimulate the excessive production of hydrochloric acid, further aggravating the symptoms of those who already suffer from gastritis, such as heartburn, pain, and nausea. Regular consumption of alcoholic beverages also impairs the natural process of mucosal regeneration, making it more difficult for the stomach to recover. Tips for reducing the impact of alcohol. The best option for protecting your stomach is to completely avoid consuming alcoholic beverages, especially during gastritis treatment. If the occasion really calls for it, limit yourself to small quantities, preferring options with a lower alcohol content and always accompanied by light foods. However, remember that the best way to take care of your health is abstinence, a decision that benefits the whole body. Avoiding alcohol not only protects your stomach, but also brings benefits to your overall health, such as improving the quality of sleep, strengthening the immune system, and increasing mental clarity. By eliminating this irritating substance from your daily routine, you allow your body to recover and function in a more balanced way, ensuring well-being and quality of life in the long term. Take care of your stomach with conscious choices and reap the rewards of renewed health. Healthy eating tips: taking care of your stomach with simplicity and efficiency. Maintaining a healthy diet is one of the most important steps for those who want to take care of their stomach, especially in cases of gastritis. Small adjustments to your routine can make a big difference in how your digestive system works and in preventing flare-ups of inflammation. Here are some easy and effective strategies to implement in your daily life. Eat small portions and regularly. Instead of eating a few large meals, prefer to divide your food throughout the day into smaller and frequent portions. This practice prevents the stomach from being empty for long periods, which reduces the excessive production of gastric acid and minimizes the risk of irritation of the mucosa. In addition, by eating in small quantities, you facilitate the digestive process, reducing the feeling of heaviness in the stomach and preventing discomforts such as heartburn and burning. Establish an eating routine. It is easy to get lost in the rush of everyday life and forget to eat at the right times. To avoid this, set alarms or reminders every 2 or 3 hours. This practice helps to create a routine that prevents you from reaching the point of feeling extremely hungry, which can lead to poor food choices or eating large portions that overload the digestive system. A balanced routine contributes not only to controlling gastritis, but also to more efficient and healthy digestion. Although these tips are useful, it is essential to remember that a healthy diet is only part of treating gastritis. Consulting a doctor is essential to obtain an accurate diagnosis. Gastritis is usually confirmed by endoscopy, an examination that allows the condition of the stomach lining to be directly assessed. In addition, having the guidance of a nutritionist can make all the difference. This professional is trained to customize your diet according to your specific needs, helping you avoid foods that can aggravate inflammation and including options that help your stomach recover.